Are you somebody suffering with a terrible chronic skin rash, hives, rash disorder? Are you somebody with an acute skin rash, hives, rash disorder? If yes, keep listening to this video. I'm going to show you a couple of pictures right now that are very intriguing, how this 18-year-old male who came to my clinic in South Florida, he went from this with spots and rashes all over his skin after medical treatments with steroids, with inhalers, antihistamines, and with antibiotics. Did not help him. 3 trips to an urgent care center. After one treatment, one visit, one unique protocol, he went to this. Clean skin, no rash, no spots on his arms or chest or face, no swelling on the skin. Incredible. If you're interested to hear how this was done and hear the description from the mother, I'm going to share with you an email in the next part of this video, an email the mother had sent me, Dr. Herman, who sent me what her son was dealing with, how scared they were that he was dying from the pain, from the itching, and there were other symptoms. He had an acute bronchitis. He had brain fog. He actually had a learning disability as well. You're going to hear an email from her in the next part of this video, and you're also going to hear the email follow-up after one protocol. How incredible the results, the dramatic, life-changing results that he's experienced and they're enjoying every day now. So stay tuned. You're going to see some pictures again, and then let's get into it. See you on the other side. I'm going to read you now an email that his mother sent me before he started with his first protocol, before his first examination with me. After I read you this email, I'm going to go over the follow-up email that his mother just sent me of the incredible improvements, which you already heard, or you saw, excuse me, the pictures, the changes there. He did have another condition, which we'll talk about as I read her email here. He did have like an attention deficit type of problem. He was in a special class in school. He also had an acute bronchitis that was not going away. And the medicines, which you'll hear her report here, actually made him worse with the skin rash condition. I am also going to go over protocols here. Or one protocol, excuse me, some unique exam findings in the protocol that was developed for him to go after these infections I found in his tissues. And furthermore, I'm also going to share a picture of a CT scan of his jaw, and that's pretty alarming because there was infection found after I did a very unique dental examination on this young man in my clinic, and then I reported to the parents there was something wrong with the jaw, and we had a CT scan performed because x-rays couldn't find a problem, CT scan, and that revealed it was just devastating what we found. So in this email, which was sent to me in August 15th of 2018, I'll pull it up right next to me. You'll see me let's go on to the computer right now together. We're going to open up her email. I'm going to hide the last name. I don't think I should show the last name where you're going to look for them online, but we're going to pull up the email now so you can actually read it. I'm just going to read some highlights of certain things that she described in this email. She said, "Good afternoon, Dr. Herman. I'm sending this blood work and medication list for Win. I'm not filling out the questionnaire work or the questionnaire I sent her because with him being 18, most of it didn't apply to him. His main symptoms now are very tired, easily stressed, rash when he does get stressed, or let's just say inflaming of the rash. The rash got worse when he gets stressed. He has trouble gaining weight. She thought maybe it's hereditary. He's had no surgeries. He was in the hospital when he was 3 years old for asthma. But that seemed to grow out. He seemed to grow out of it with chiropractic care and holistic care. He hasn't had any antibiotics until this past May when we took him into urgent care. Here is the story. Wynn started running a fever with a cough around the middle of May of 2018 and complaining that his body was aching all over. I did everything I knew holistically with chiropractic and essential oils and nutrition. After the fever would go down and up for about 10 days and wouldn't go away, we took him to urgent care. They did a chest x-ray and said he had acute bronchitis. He was given dexamethasone injection in his right buttock. They sent him home with Ceftonir antibiotic. He took 1 capsule of that Ceftonir antibiotic that night when he got home, and 1 the next day around noon, and by the time he took the 3rd, he was back at the clinic with his eyes and lips swelling. Or the eyes and lips started to swell, is exactly what she said. They sent him home with Alahist, an antihistamine, and azithromycin Z-Pak tablet, and methylprednisone, tablet. I was too scared to give him much of this medicine because he then started to break out with little dots all over him. Let me show you the picture again, what the dots look like on his forearm. I think I gave him 1 azithromycin and 2 or 3 of the Alahist. I gave him about 4 of the methylprednisone. The next day, the little bumps were everywhere. His feet, his scalp, it covered his chest, his neck, and back. It was very scary, she put in capitals. We took him back to the doctor, and they did a pee test, a urine test and blood test, which confirmed mononucleosis, or Epstein-Barr virus. This is the first time they did a blood test on him. So they medicated him without even testing him in any way before. They just looked at him, medicated him. Antibiotic, antihistamine, steroid. No blood test, no urine. So I don't think that's the ultimate responsible way of handling it, but hey, that's the way that they did it. They hooked him up to an IV of an IV fluid to replace some sodium, and they gave him solumedrol injection. He went home, and she seriously thought he would die. He was in so much pain from the itching. He was scratching. Wynn asked me, "Mom, am I going to die?" The little bumps went from little dots to connecting and making hives all over his body. He would just scream and ask me to help him because of the itching. We tried everything, coconut oil, lavender essential oil, which helped a little bit. And then we started Benadryl every 4 hours for 2 days. And then I called a friend, a pharmacy friend of hers, of mine, and she told me to add Pepsid AC at the 2-hour mark after taking the Benadryl. This did help. He would take cold showers to help some with the itching. He just moved around from bed to bed because mentally he was losing it because of the pain. He gets stressed, it gets worse. He sleeps every chance he gets. He looks greenish and his eyes are glassy looking. I've added vitamin B and D to his supplements and seen some of his color looking better. There's some other support that you gave him, some other kind of nutrients. He is still he's still dealing with lung issues and sounds like his bronchial tubes are struggling. I know that Wynn has, and he said still does do, let me just say, a certain practice of inhaling a certain, let me just say, because certain people are not supposed to know this, so there was a certain inhaling a certain something that he liked to puff on. He says he still does it about once a day. He had a cortisone shot somewhere in the 2nd or 3rd visit with the doctors, and basically that's it. She looked forward to our meeting Friday to talk more. Now, the follow-up email that she gave me after the results that happened after the first protocol. Here's what she emailed me. This was in January 9th of 2016. Now, I'm going to tell you, he had to leave school. They wouldn't let him in the school because of the rash. He was feeling more cloudy in the brain, more of a brain fog, lack of attention type of situation was going on with him. And they thought maybe he was contagious, so he stayed home. Okay, so here's the email that and I'm so grateful that she wrote this to be able to share with you all. Wynn came to see Dr. Herman. This is a testimonial report. She has not been back to my clinic with him. The other child is coming here for another condition. But she didn't come back with the other child. Her husband brought him down. So I'm just going to say that she sent me an email, and I'm really grateful that she did this to help us understand, help you understand the incredible results that they've achieved with this work that I'm offering them and you. Wynn came to see Dr. Herman in the fall of 2018 with a severe case of mono. He also had respiratory issues and stomach problems along with brain fog. He had been diagnosed and put in an IEP program at school with language help, let's just say. So it was more like an extra help program where he wasn't grasping things well enough. They said basically he was having trouble with comprehension and communicating from brain to paper. That was the problem before coming here, even before the rash, I think. But the major problem was the mono completely took over his whole skin, his whole body. It took over the whole skin appearance, so I can only imagine what it was doing inside his body with this disease. He was in so much discomfort from the itching and swelling of the rash that he couldn't attend school, which he had a tutor and did the fall semester at home. He was so tired he slept for more hours than being awake. He quit football because he had no energy! Exclamation point. So we took him for his first examination and protocol and came home with the remedies for a 66-day regimen from Dr. Herman. The first real thing we started seeing was his lungs clearing up and getting better. The coughing and congestion was getting better and better, exclamation point. Then his skin started to clear up about halfway through. He stopped having to take the Benadryl and he started eating so much better. Then he noticed his brain felt better. He would get terrible headaches when he would try to think too much. Well, by the end of the protocol, I can definitely say he was a changed person. His skin cleared. Before the protocol, the rash would flare up so bad and swell when he was under any kind of stress. He was so excited and told me, quote unquote, "Mom, the rash is gone and hasn't come back even when I'm stressed," exclamation point. His energy is completely back. He's working out at the gym again and has gained weight. He had lost 15 pounds with the onset of this disease. He's gained much of that weight back now. His stomach is so much better. No pain after eating or exercising, exclamation point 3 times. I believe Win can get healthier than he is right now, but he is 85% better after the first protocol, exclamation point 3 times. Again, we are so grateful for Dr. Herman and his staff. Dr. Herman is the kind of doctor that is determined to help his patients feel better, and he gets down to the issue, not just give the medicine to cover up the symptoms, as other doctors may do. He has always corresponded fast and called us to talk if needed. We are grateful that his research and hard work has helped our son get his life back again as a teenager, exclamation point. Thank you, Dr. Herman and staff. That's pretty incredible. His one and only protocol, September of 2018, I saw him with his parents here. We're going to describe it right now. Before I even get into this part of the protocol, or this protocol description, I want to show you here is the finding that I discovered in his CT scan, because when I did a unique dental exam, I said there's a problem in that mouth, and we've got to take a look with a special kind of CT scan, because x-rays, from what I understand, x-rays will only find the infection when it's 75% advanced. And there's better technology with a CT scan, which I run with most of my patients to find if there's infection in the jaw, which may not have any pain, any symptom. One of his front teeth, where you're going to look at the CT scan now, it's divided the skull in half, and we're looking at one slice of the jawbone and the 2 front teeth here, okay? And so when you look at the bottom tooth, which I'll show you in the picture next to me, when you look at the bottom tooth, you're going to see, let's take this off for one moment. You're going to see that the jawbone and the tooth, it's a good foundation for the tooth to be inserted into the jawbone here. The upper tooth, I'm going to draw some arrows around that upper tooth, you'll see in the picture next to me, is that there's decay. There is decay of the bone above the tooth. The tooth looked to be healthy on the CT scan. I could tell there was something wrong with that tooth in the jawbone, but the tooth looked to be healthy. Tooth is not a cavity either. Not a cavity, never had a filling, no root canal. Above the tooth in the jawbone, there's a lot of infection that's eating away at the jawbone. You could see the dark color. It looks like a circle of a ring around this root of this tooth. So that's got to be handled. It wasn't handled before this first protocol. Sometimes it does have to be handled. Sometimes it's just not the step that people are going to go to first. And whatever decision you're going to make, I have to go to stick by it. But we've got to get that mouth cleaned up. I'm going to tell you because the infections are still there, but they're going to come back into his body. And what we would not like to see is a relapse. What we only want to see is him continuing to improve and just keep going and having a great life, and no more of these skin rashes or hives or bronchitis and so on, because the infection from here can go to the skin, can go to the lungs, can go to the heart, can go to the brain, can go to the kidneys, to the stomach, can go anywhere in the body through the blood vessels. I'm going to show you a picture right next to me now of what it looks like for the arteries, not the nerves and not the veins and the capillaries with the teeth and the skull, but just the arteries of themselves. We're going to see these red lines that are arteries in this drawing coming from each tooth to the jaw. They connect and they go into the whole face. They go into the carotid artery. They go anywhere in the brain and the body, spinal cord, any organ can get the infections from what's in his jaw. I have a feeling the infections are coming from somewhere else in the body, actually going into the jaw, and that tooth will eventually become very diseased, and eventually, if he doesn't handle it properly with the right dentist, the tooth will fall out because the foundation is dissolving up there. And what he doesn't want, and what his family doesn't want, is the infection to spread to other neighboring teeth, which can cause him even more dental complications in the future. Whether that's 1 year, 10 years, I don't know. I found with his skin, and remedies were made for all of these to clear these up. No, it's not baking soda. No, it's not using some kind of colloidal silver. No, it's not a Rife machine. No, there's no Hulda Clark type of treatment. Whatever you're thinking out there, there's no herbs. We're using specific remedies that we make in our laboratory here. His skin, he had the morbillovirus. His skin also had the Epstein-Barr, the monovirus. He also had, in his spleen, he had the Epstein-Barr virus. In his spleen, which is part of, you've got to know that your spleen is part of your lymphatic system, your cardiovascular system, as well as your immune system. The spleen had the Epstein-Barr virus and Stachybotrys, which is black mold. His stomach was infected with parasitic infection and morbillovirus. How do we get these? Maybe a mosquito bite. Maybe somebody coughed in the room in school, then there was an airborne virus that he picked up. I don't know where it came from, but it can come from many different ways. And the parasite can get into the stomach because maybe he ate some food that had a parasitic infection. You know, it didn't have to be worms. Microscopic organisms can be in hamburger meat. They can be in anything. His cerebrospinal fluid, which is fluid around and throughout the entire brain and spinal cord, he had the influenza B virus. In his lungs, he had the vaping chemical. We had to remedy that out of there because that chemical was not good. They're not healthy. I found in his lungs he also had the morbillovirus and the Epstein-Barr virus. Remedies were created to provide him relief of those infections, help his body get those out. His bronchitis problem is gone. His energy is way up. His brain is clear. And he's having no more rashes when he's emotionally stressed. I also found with him in the frontal lobe of the brain, which is part of cognitive function and memory. I found the Epstein-Barr virus in that frontal lobe as well. And I found the Epstein-Barr in an area of the brain known as the hippocampus. Hippocampus, there's one on the right and one on the left, right above the ears. The hippocampus is a unique tissue in the brain where memory central is. That is the memory part of the brain. There are times that people can have, with emotional stress, because the brain itself winds up to emotional stress, and the brain itself can have the infection and make the body have, like on him, the rash presentation on the skin. I'm very proud of his recovery. I'm very happy for them. He can get back to his life. He does have to handle the dental condition that I found with his jaw, because he doesn't want the relapse of this, and they don't want the relapse, but it's something that will come in time to clear up that jaw infection. But we're very happy of his incredible results here, as you can hear from the exclamation points in his mother's email that she so generously shared with us here, that he is completely, 85%, she said, relieved of the skin condition, relieved of the stomach problem, relieved of the hives that would come with his emotional stress. The spots on the skin are gone, and the respiratory condition is gone. The brain is clear, and he's doing great. He's back in the gym. He put on weight. Awesome. Awesome. Share this video with one friend, just one friend, so that you can share with somebody who's suffering, that they can find a person who can help them get better. Okay? Also, you can like me on my Facebook page. I put up unique information there on a regular basis. Also, you can follow me on Instagram and Twitter. Subscribe on my YouTube channel here. There's actually a button right down here in the corner that you can click, subscribe, and turn on notifications so that you can receive emails when I do put up new videos. Go through my playlists on my YouTube channel. Look for other information that's there where I've put Parkinson's and anxiety and fatigue and brain fog and other inflammatory nervous system conditions. We've got great results, incredible results with many of these different conditions, diabetes and multiple sclerosis. So watch these other videos here. I'll just tell you that one thing, unfortunately, medical insurance, healthcare insurance doesn't cover the kind of work that I'm offering, so this will be an investment in yourself. And my assistant, when you contact my clinic, I'll put up the number in a moment, when you contact my clinic, my assistant can go over those fees with you. Okay? It is usually, like with him, it was a 2-hour visit in my clinic, a very extensive, long exam with just my assistant with me and him. Sometimes visits here can be about 2.5 hours in length for one patient. Okay? So we're very dedicated at getting these incredible results. And I wanted to go for you as fast as possible. There's no way I can't guarantee that. I expect you to get better, but you and I both don't know. And your family and friends who may think that they know a lot, they all don't know. And your doctors who you've seen don't know how many different infections and toxins are in your tissues that are causing your body to have the symptoms that you've developed, whether it's asthma, whether it's bronchitis, whether it's skin rashes, whether it's hives, whether it's brain fog. They just can't predict that. We've got to use a very unique exam process, expanding on years of research I've done in neurology and neurochemistry and immunology and endocrinology and blood chemistry analysis and gastrointestinal disorders and biophysics and cardiology. And there's so much going into this, and food sensitivity testing. There's so many tests I used to do. A lot of them I've had to excuse and put by the wayside because they were not finding answers. Real results, real person. The number to my clinic, when you're ready to make an appointment here, call my clinic at 954-370-3100. That's 954-370-3100. And you can even email my clinic assistant. I'll put the email address up here as well. And she can get back with you. Some people come, most of my patients are coming from out of the country, some from within Florida, a lot from across the United States, mostly from other parts of the world, from Canada, United Kingdom, Mexico. We've had from Uruguay, we've had from Honduras, we've had from Australia, New Zealand, Norway, Netherlands, Thailand, Israel, Russia. So listen, it's not too far for you to be able to come here. And if it takes us one, if it takes us 5 times, if it takes you more than a year to get better, but you can start to peel away the layers of your condition and help you get better. Okay? Thank you for watching this video. Watch a little more details at the end here that I'm going to put up. And I look forward to helping you overcome your acute and or chronic condition or conditions. See you soon.